All right, so welcome everyone to the Homelessness Forum sponsored by the Presbyterian Church of the Apostles. The purpose of our forum is really threefold. One, to raise awareness in the public that there is a problem, and to discuss the manner of that problem and the odiousness of that problem. Also to clarify any misunderstandings that people may have as to either the problem or potential solutions to the problem on a factual or a policy basis, and to explore those actions or solutions on a macro level, which would be policy, either from a city, county, or statewide basis, or on a micro level, which is one homeless person at a time. What can one person do or a group of people do to at least start working on the problem? So we have a panel of 6 agencies. The first is Sergeant Max Yakovlev, and he's from the Burnsville Police Department, and he is from the Behavioral Health Unit, and he will discuss his experience and what resources he has available in dealing with the homelessness problem within the Burnsville Police Department in the city of Burnsville. The MICAH organization, Sue Watlov Phillips, has some words to say, but mostly a video. And again, she's a founding board member and executive director of MICAH. We have a number of representatives here from the Dakota County Social Services: Madeline Kastler, Marty Fishbach, and Evan Henspeter. And they will again give you the institutional knowledge that they have and what they see as the problem and potential solutions. We have Dr. Teresa Battle and Amy Piotrowski from Independent School District Number 191. Dr. Battle is the superintendent, and Ms. Piotrowski is the director of student support services. Again, because homelessness is not just having a place to stay at night and keep the cold out. It also affects the things that you do during the daytime, and everything from nutrition to learning. Katie Goodbjartson from the Thomas Allen Corporation. Corey Megstaff is the executive director of Launch Ministry. And I think that's it. So the format is going to be, each presenter will give an approximately 10-minute presentation individually. And when all of the presentations are done, we are going to take written questions from the audience and from Zoom. So anybody that has a question about really pretty much anything having to do with the topic or what we talked about tonight, if you could save them up toward the end, it just seems like it would work better to have individual questions all at the end, rather than interspersed in between. So to that end, we will be giving out, there's some cards and a pencil or pen at the end of each row. If you are inclined, just grab one, write a question. We'll be out to collect them when the presentations are done, and then we'll see if we can come up with some solutions. So with that, I think Sergeant Max Yakovlev would be my first.
Can you guys hear me okay? Oh yeah, I can hear myself. Like Dave said, my name is Max. I've been with the Burnsville, this is year 25 for me, and I work in our behavioral health unit. What we want you guys to know about that is my partner, Erica Houston, Officer Houston, and I respond to all of our, as many mental health related calls for service, which includes anything from somebody who's having a bad day to severe mental illness, addiction, drug addiction, alcohol addiction, that kind of stuff. In our unit, we also have 2 embedded Dakota County social workers. One specific one is designed, her job is to respond to calls and progress calls with us. So that means that Leanne is our social worker. She's actually in the squad with us. So we respond as a team to some of these calls. And Randy Madden, she is our other social worker. She's our embedded social worker. And really what I want you guys to know about that is her job is to stabilize some of our clients in the community. And really what that means is we're trying to find, I guess would be resources and things that they need without taking them out of Burnsville, right? So the goal is to have that person in the community, function in the community, be part of our community, and making sure that they have what they need. We also have a part-time paramedic in our program from the Burnsville Fire Department, and that person, there's actually 3 of them right now, but they kind of alternate. And they help us with any overdose cases that come through, and we go back, after an incident and make sure that they have what they need in case something like that happens again. Another thing to know about our unit, aside from responding to calls for service and progress calls, as we call them, we, like 2-3 days later, we do go back and follow up with people, make sure that they have the resources that they need, and they're safe, and they're following doctor's orders, essentially. And if they don't have some sort of information, or maybe they lack some resource like maybe financial or housing in this case, we're trying to provide them the proper avenue. As far as the homelessness stuff goes, we work with Allied Services and Dakota County Crisis quite often. Allied Services is a nonprofit organization. They're in Dakota County. They're kind of all over the metro, really, but we work specifically with Dakota County segment. And they basically call us if there's a safety concern when they go out and deal with some of the homelessness folk. The other thing is important to note too, I shouldn't say a lot. Some of the cases that we run into, people do have mental illness or persistent mental illness, or maybe in addition to that, they have some sort of alcohol or drug issue. So sometimes it's not safe for our ally partners to go by themselves. So we go there to make sure that everybody's safe and keeping the peace. And making sure we connect them to appropriate resources as well. Some of the things that we've been noticing, we do have some folks that are living in our parks, in the woods, not a lot, but we do try to make contact with them as fast as we can to make sure they have what they need. And often we find that that's just the lifestyle that they're choosing, and they don't need anything from us or the social services. But if it gets really, extreme weather-wise, whether it's cold or really hot, we do go back and check on them, make sure that they have what they need for that time of the season. Because we do find and everybody lives in Minnesota, obviously, so if we have 30 below wind chill, it's pretty cold, and we want to make sure that they're taken care of. Same thing with food and water. The other thing that we've been seeing quite often, and I'm sure if you live in the city, you'll notice people that are on the panhandling and on the medians and whatnot, where we're trying to address is the safety concern more so than the panhandling piece. We want to make sure that they're doing it safely and lawfully. And aside from that, panhandling itself is not a crime. It's actually covered by a First Amendment. Our big concern is they're standing in the median, and that becomes a traffic issue and a safety issue for the people and the drivers. So we've been addressing that as much as we can as time permits. By doing that, I can tell you that we issue very, very little amount of citations. Our goal is to education and provide services. So my unit and community engagement unit and patrol officers too, we go out there and provide them that information and make sure that they have what they need as well.
Could you just tell us what, like an approximate percentage of like the people that you deal with in a week or a month, how many of them, what percentage of them have a homelessness issue as opposed to some other type of issue?
I couldn't even tell you. I'm not sure on the percentage wise. I do know, because we don't keep track of that information, but I can tell you that folks that we do run into, they're not Dakota County residents. They're from Hennepin County, Ramsey County, and oftentimes they're actually not homeless at all. They're just here to panhandle at times.
Okay. Would you like to be next? All right. Our next speaker is going to be Madeline Kastler from Dakota County Social Services.
Great. Well, thank you for the invitation to be here tonight and for calling attention to the issue of homelessness in Burnsville and Dakota County. I'm a deputy director in our Dakota County Social Services Department. I'd also like to introduce, in addition to the other representatives from our staff, Marty Fischbach and Evan Henspeter, I'd like to introduce two of our commissioners, Liz Workman and Mary Liz Holberg. And I'd like to just see if either of them want to say any words. So let's go to the next slide. So the reaction to the tent on your property is a great window into how our community at large responds to homelessness. The people that we hear from sometimes, and I'm sure you heard reacting to the tent out front here, were reacting with fear, sometimes judgment about why the person is experiencing homelessness, maybe anger or disbelief. They can't be from here. We don't have homelessness in Dakota County, or concern for their own safety. And people also react with concern for that person sleeping outside, questions about how government intends to respond to that person's needs, and questions about how the community can help. And I think that's why we're having this conversation here tonight. It's about how people can help. So this picture here is from our recent count of people experiencing homelessness at the end of January. Question, is this mic bouncing in and out?
Just, it varies, you have to have it within an inch or two of your.
Great, I'll try and be more consistent. So this picture is from our recent count of people experiencing homelessness at the end of January. The fact,
Try this one. Maybe a lot.
sorry, it worked for Max. We counted 80 people on that night at the end of January in Dakota County sleeping outside or in their cars. So the fact is that this really is a part of what Dakota County is experiencing. It's part of our story, and it is worth talking about. So thank you for hosting this tonight. If you could go to the next slide. So the housing services area at the county, which is the area that I oversee, helps Dakota County residents at all stages of a housing crisis. We help people who are at risk of becoming homeless and losing their housing through our homelessness prevention work. We help people who have lost their housing and need to get back into shelter or need that street outreach that Max was talking about. And we also help people who have recently moved back into housing after experiencing a housing crisis and help them with their housing stability. I want to share a couple of examples of our work that are throughout that continuum of prevention, shelter, and housing stability. So the first being with our prevention work. We operate a housing clinic, which is a service that we provide at eviction court. And it's to help people avoid evictions at that very last minute. So it's that last ditch effort to help people from becoming homeless. At Housing Clinic, we offer legal services, court navigation, and access to financial assistance. And I've got some of our partners on the screen here. 360 Communities helps with that court navigation and access to financial assistance. We have legal representation with Southern Minnesota Regional Legal Services and others, and the partnership with the courts. Just for reference, there were approximately 1,800 evictions filed in Dakota County in 2023, and our housing clinic served 800 families. 84% of the families that we were able to serve through the housing clinic did not fit following that court hearing. So that intervention works. We know we need to get upstream. I'll talk about that a little bit later. We know we need to get upstream from the housing clinic so people don't get that eviction filing in the first place, but that intervention has really made a difference for people who end up with an eviction on their record. We'll go to the next slide. This one's hard to see, I apologize. But through the housing clinic, we can see who is really hardest hit by housing instability. It gives us a nice window into what we're seeing, who's at risk for losing their housing. So there's some circles that are going to pop up here. The majority of the people we served in housing clinic are female heads of household. They are non-white, and their households are earning between $37,000 and $62,000 annually for a family of 4. And we know that we know that those are the residents of Dakota County who are most at risk, and it's evidenced here. We can see it really clearly through this housing clinic intervention. So those are the folks, if we were looking for determining where to get upstream and how to prevent more people from losing their housing and facing that eviction, these are the groups that we can start to narrow in on. And for a local perspective, we can go to the next slide. Burnsville was one of our biggest, Burnsville residents were some of the, Burnsville was one of the biggest service areas that we had in the housing clinic. That's in part because Burnsville is big, it has a lot of apartment units, but also we're seeing a lot of folks that are living right on that margin of poverty in Burnsville. So we also help people who need shelter. We have 22 beds for families at Dakota Woodlands, which is in Eagan. We also provide overflow shelter for families in hotels throughout Dakota County. And we have 85 rooms for single adults, all in hotels throughout Dakota County. That's how we provide shelter. The picture here is of some of the families that we've worked with over the years, and their keys to their new apartment after living in the shelter, and these keys represent a new start and stability. We have examples of people that we've helped in shelter over the past year. So an older woman in her 70s in our single adult shelter program who was living in her car following the death of a family member and subsequent loss of household income. A single man who was homeless after facing several health issues himself and lost his job due to those health issues. And a family with 3 children who was in shelter after an eviction due to lease violations that were related to untreated mental health symptoms. Everybody's story is unique, but there is a theme to the experiences that people are bringing to either eviction court or shelter, and that is medical crises, job loss, mental health struggles, lack of family support, lack of community support, or substance use. People who have been living oftentimes stably in our community for years and suddenly need to ask for assistance. Throughout all of our services, prevention, shelter, housing, we helped 2,500 households in 2023, all with stories like that. And there were, of course, many, many households that we couldn't help. So we're working to bridge that gap, thanks to the leadership from our board. We're expanding our eviction prevention services, so trying to get upstream from that housing clinic work. We're continuing to work on expanding our affordable housing resources in partnership with our Dakota County Community Development Agency. And we're trying to find a permanent home for our shelter for single adults. Like I said, we've been operating in hotels for the past 4 years. And we're ready for a permanent place to call home. You can go to the next slide. We proposed a shelter location last fall. It didn't go that great. And we ended up with a room full of folks who were not super supportive of the location that we selected, but we're gonna try again. We're gonna be building a network of supporters to help us on our journey to find a home for this shelter program. So if you're interested, please talk to me or talk to any of the folks from Dakota County afterward. You can go to the next slide. host more conversations like this. These conversations are super important. So if you're interested, also contact me afterwards, or you can call me tomorrow if you're interested in hosting a conversation like this. And then our community partners always need donations and support. So Dakota Woodlands, our family shelter, Ally Supportive Services, who partners with our police officers, the Link, and Guild. So thank you very much for the opportunity to be here tonight.
Thank you. Would you like to be next? Yes. All right.
Thank you. Good evening, everyone. Teresa Battle, Superintendent, District 191, here with Amy Piotrowski, as well as Dr. Chris Belmont is joining us, the Assistant Superintendent. Many of you know him. He spent his entire career in 191, so he can help answer questions too. I want to tell you about the children who are experiencing homelessness. They want to be loved, seen, they want to be with their friends, and most importantly, they and their families want them to remain in school. And so I'll tell you about two brothers. When I visit the schools, every time they see me, they ask me for a hug. Many times I see them at dismissal time or after their after-school activity when transportation is taking them on an hour drive to live with their grandmother. So some of our students, they reside in Dakota County, but others do find family members that will house them, but they want to stay in school. So to give you some data, I have approximately 7,000 students. We have 325 of those students experiencing homelessness, 39 preschool students, 147 elementary students, 60 middle school students, and 80 high school students. That also include my transition program for students 17 to 21. Amy's going to give you a little bit more information. There is dedicated funding for us to support those children and their families. So she'll tell you about the funding and those resources that we provide to them.
Thank you, Dr. Battle, for the story about the children, because that's why we're here. This is our why. We are here to support our students and our families who are experiencing homeless. One of the things, so we do get some funding from the state under the McKinney-Vento law legislation, and that is just to basically make sure that students are able to come back to their home building where they can stay consistent, because we know that our students and our families who are experiencing homelessness, they move around a lot, sometimes with family members, sometimes just for a short time. But the one thing that we can stay consistently is to make sure that they come back to their school with their teacher in their same desk, with their friends, with their lunches and things like that. So that is really important, which the McKinney-Vento funding allows us to be able to do that. When the law, the McKinney-Vento law, so one of the things that they did is that they have some criteria that, not really criteria, but some things that they want to ensure. And one of the things is that any student who is experiencing homelessness gets access to school immediately. We know that by missing school, they're not in school, they're not learning, therefore the continuum just kind of falls and the gap continues to grow. So their goal is to have them into their school of origin, which is, that's the school that they start with. So when they're experiencing homeless, we will bring them back to that school for that piece to have there. They receive transportation, so we work with Schmitty & Sons. And so we're able to transport through Schmitty & Sons around this area, but then they also are able to contract if we have students that are up in St. Paul or Minneapolis to be able to bring them back. And like Dr. Battle said, it is a long drive, but it is worth it for our students and families to have that consistency. One of the things I want to thank Madeline for bringing up is because this is the first year that we have partnered with Communities 360 or 360 Communities. And so she talked a little bit about it, but it has been a wonderful partnership for our families because they're able to get them back into housing. And so they're able to work with the families, help them fill out the paperwork, find them housing, working with the owners or whoever the apartment buildings are, and to get them in there. So far this year, we have 5 families that they've been able to find housing for in our district. And so that is really important for them, because now they have more consistency, and they have their own bed to sleep in at night. Another program that we just have this year that kind of we're really excited about is that, we know that we've been experiencing some blended learning things. COVID taught us a couple things, I guess. And so kids that couldn't be in school, but a lot of our education, especially with our secondary students, they have Chromebooks, but they can't access their education if they don't have Wi-Fi or hotspots. And so we provide hotspots for families to be able to get on the internet and to find some of those things. T-Mobile was able to partner with us and actually get hotspots that are cell phones. And the nice thing about those cell phones is that they are able to browse the internet, find jobs, access food or other resources that they may not have. And then they're also able to access all of our apps on our 191. And so our students and families have access to that as well. So we're fortunate to have a lot of those things in place. And the funding, other things that we're able to do with the funding is, besides hotel rooms, if we have a family that is experiencing homelessness and they need a space right away, the funding allows us to, for a short term, be able to pay for maybe hotel rooms. We provide them with gas cards. Cub Foods has been working with us, and so they get food and things like that. And then also we have social workers in every single one of our buildings that are McKinney-Vento liaisons. And so they are the ones who really are working with the families to make sure that they are getting some additional resources out. And one of the things, I know that Dr. Battle kind of gave the list of students that we know are homeless, but we also know that we have way more students out there than what we're just aware of. And so that awareness and things, we're still working on making sure that our students and our families have access, that they're able to come back. And a lot of our families don't want us to know that they're homeless, for obvious reasons. But, as we are able to talk with them and get them, we're able to get them some of those resources that they need. So, but yeah, that's what we do at 191.
He's got. Can it?
Test one. There. Hi, everyone. All right. My name is Corey Mogstad. Again, I'm the executive director at Launch Ministry. We work with youth and young adults experiencing homelessness, primarily in Scott and Carver County, although last year, roughly 10% of our youth came from Dakota County. Youth experiencing homelessness are notoriously transient, and so they will find a place where they can find the supports that they need. I was also moved by the tent story of kind of the thing that spurred on this event. I think that I love this church's response to that experience, to say, hey, this really gross thing happened. We want to take a moment to educate the community and educate ourselves, frankly, rather than just put the tent away or whatever, because I think community responses and community attitudes are a big part of what drives the challenges in homeless response. And when the community comes on board and says, hey, these are our friends, our neighbors, our relatives, and we want to support them, that's when the other challenge, which is the kind of system challenges, can actually be addressed when we have community support kind of pushing up against that, and then the system responses respond to that. A couple things about us organizationally. One is that we are unapologetically multicultural, and why that's important is because, as we saw in the Dakota County stats, so thank you for sharing those, particularly in youth experiencing homelessness, but really across the board, people of color are disproportionately affected by this. Internally for us, we see about 70% of our participants are youth of color. The stats statewide are probably closer to 80%, sometimes even higher. And then the second thing is culture is not just race, it's also identity. And so LGBTQ youth are disproportionately affected by experiences of homelessness. And so we see roughly 30% of our youth that we work with every year that are LGBTQ identifying, and that is a primary reason why they're no longer able to be home with their families. And so because of that approach, we've really said that internally we need to do everything that we can to shift our own systems and structures and ways of doing things to ensure that not only do we provide services that are available, but that the services that we provide are actually accessible to those who need it, because we have an alignment on values and alignment on the ways that they want to and are able to receive services. So we really put a lot of agency on the youth themselves to be able to say, this is what I need, this is how I want to kind of receive these services. And so as a result of that, one of our key values and how we approach this challenge is all about trust building. Let me tell you just one brief story. So a couple of years ago, we had a young woman who had been in our program for probably 6 months, 7 months, 8 months. We have a mentoring program where you can meet with our staff weekly. They get incentivized with gift cards. We have a drop-in center, so she was coming to our drop-in center. She was working on maybe homelessness, her housing, because her housing was kind of unstable, but she hadn't really disclosed much about that. And so we were just kind of working with her, as we do with all of our youth. About 7 months into that relationship, meeting with her mentor, meeting with our staff weekly at least, and sometimes more often, she sat down with her mentor and said, "Hey, could we talk about my housing?" And the mentor said, "Sure, yeah, what do you want to know?" and she said, "Well, for the last year or so, the only way I've been able to be stably housed is by performing sexual favors for the person who's letting me live here." This is a 18-year-old young woman trying to finish high school, and she said, I don't really want to do that anymore. Is there anything you guys can do to help? Yeah, we have lots of things that we can do to help, and we would have loved to help start 7 months ago, but it took that much time for her to be able to see who we were, see that this was a safe place to disclose this thing that she was really embarrassed about, really hurt by, that was really traumatic for her, and also then be able to say, I trust you enough to disclose this part of me, and trust that there's a better path forward for me. And so I say all of that because as panelists up here, we're all in leadership positions, whether it's law enforcement, county, school district, nonprofit, for-profit, and all of us are systems, right? And every one of us does harm to the young people that we serve at various ways, whether it's things that we haven't addressed internally yet, whether it's just mistakes, accidents, whatever. And so all of us have this like central need to really work on how do we become trustworthy, because particularly for young people, they've all had challenging interactions with systems, and they're all kind of high users of these systems, right? And when those things happen, it becomes much harder to actually address the challenges. And so part of this whole interaction of what does it mean to be a kind of leader in the space, also a community member of the space, is how do we change community mindsets, and this event is a great way of doing that, but then also how do we as the systems start to challenge the ways that we cause harm to those individuals, work on that stuff, and then figure out ways to build trust amongst one another, to build those relationships so that we can work together more effectively. I can talk more about our programming later. We work with roughly 300 youth per year. We have kind of programming across the gamut from emergency shelter to drop-in center to scattered site housing to we run a cafe that's a youth employment program that is a super cool new program that we just started. But mostly what I wanted to talk about is some of these bigger issues, like how do we become better so that the young people and really anyone who's experiencing these challenges in life can find the resources that they need and ensure that the supports that they need are actually meeting the needs that they have.
I believe our next panelist will be Katie Gudbjartsen.
Okay, so I'm Katie or Catherine Gudbjartsen. If you get an email from my work email, it'll state my legal name. and then people get confused. So I work for Thomas Allen Incorporated, and we are a for-profit company that, it's been a long day, is contracted with just about every county in Minnesota. If we don't have a contract in a county, we likely still have people that live there, but their waiver is funded through a county that we are contracted with. So I have 57 people on my caseload. I have anywhere from 6 months to 106. And of the people on my caseload, 20 of them right now are homeless or considered homeless. And according to Health and Human Services, as far as MA funding, medical assistance funding for their waivered programs, that's anybody that doesn't have stable housing. So they might be couch surfing with a friend, they might be staying with a grandma or an aunt, but they don't technically live there. Their mailing address might be a PO box, and they are certainly in a homeless encampment or in jail or juvie. The list kind of goes on. I have a 16-year-old kid on my caseload right now. As a baby, they were given up right away for adoption. They were adopted right away. At the age of 3, they were put back into the foster care system because the adopted family didn't know what to do with them because they were crying, they were always whiny, they were misbehaving and getting into mischief, as some toddlers do, so I'm told. So they went back into the system, they were in foster care until they were 16, at which point they ended up in juvie because the foster care system didn't have anywhere else for them to go after they had bounced around from house to house and continually had behavior problems. If anyone has ever had a temper tantrum, it's normal. Behavior is communication, and for this kid, they never got the early education that they needed. They never got into public schools or private schools or any schooling, so they just didn't know how to be social. And so for 6 months, this kid sat in juvie because there was nowhere else to put them. But we needed them to be safe and needed them to be off the street. I have several people that continually go to jail because they know that they're gonna get a bed and they're gonna get a meal. And it's consistent for them. Otherwise, they will be homeless. So that's what I see on a day-to-day basis, amongst other very, very tragic things. But we partner with Health and Human Services through our counties, through other places like ACRA, Fitzgerald Home Care, any home care agency really in the state of Minnesota that's able to bill the funding. We partner with them so that hopefully people will get the needs met. We do home delivered meals with the community action partnerships, Mom's Meals. There's other home delivered services. We try to do transportation the best we can. Unfortunately, as many people know, transportation is not easy. And in Minnesota, the more you get outside the 7-county metro, the harder it gets. The buses, the light rail, that stuff doesn't run to Fairmont even sometimes, or further south yet. The little tiny towns, even like New Prague, it's too far out. Even though it's in Scott County, it's too far out and they won't get a bus service. So we deal a lot with transportation. Our main thing is just meeting health and safety needs and making sure that people are able to be fed, have a roof over their head, have clothing, have jobs if they want to have jobs. So we work a lot with the state, with the economic and development, and try to get people jobs so that they have their own income. Eventually, hopefully they work full time. That's always the goal. Some people just aren't able to do that for a variety of reasons.
Thank you. And our last presenter is Sue Watlov Phillips from the MICAH organization. She's the executive director. And are you ready?
Sure.
All right.
Thanks so much. And thanks, Doug, for inviting me. And I want to thank your congregation for your support of MICAH throughout the years, and also providing a space for us prior to COVID to actually meet in for our Dakota County chapter called the MICAH South chapter. Want to thank all of you and praise God for all the great work of all the panelists that you have heard already. I've had the honor to serve God for the last 57 years, working with people experiencing homelessness, housing instability, and discrimination. I actually experienced homelessness myself over 50 years ago when I was 19, when I was playing varsity basketball at the University of Minnesota, and I got hurt and could not work and could not continue to afford my apartment after a couple of months, ran out of savings. My parents also experienced homelessness after my father had served in the Marines in World War II. They got married, and when he left the service, they did not have enough money to afford housing and had to move in with family in northern Minnesota. MICAH is the Metropolitan Interfaith Council on Affordable Housing. We developed 35 years ago, people of diverse faiths coming together to address a growing number of people experiencing homelessness. And the mission is to ensure everyone without exception has a safe, decent, accessible, and stable home, which includes rental and shared and home ownership, and is affordable at 30% of their income, meets their needs, and in the community of their choice. We want to be a welcoming community where we love and we treat others as ourselves. You've heard some great statistics about what's happening here in Dakota County. Just to add a little bit to that, so in Minnesota, we have 17,000 children that are in our school system that are experiencing homelessness. I had the honor to serve as the executive director of the National Coalition and was one of the founding members and the National Coalition for the Homeless Policy chair right now to pass the Education for Homeless Children and Youth Act, as well as the original McKinney Act too. So we have millions of people that are experiencing homelessness across the country every year. 40% of those folks are folks that are unsheltered, living in that type of tent that you saw out on the lawn. And as you saw the pictures that Madeline showed you too. So in the United States right now, 78% of Americans live paycheck to paycheck. Over half of Americans are 1 to 3 paychecks away from not being able to make their rent or their mortgage at any given time. And over half the American population at some point in their life will experience a mental health or a chemical health problem. But yet in 2024, we still oftentimes see in our media and sometimes in our society that we blame people for experiencing homelessness. So I want to show you a short video of the work that we're doing at the National Coalition for the Homeless here in Minnesota about bringing America home and bringing Minnesota home. You also, on this sheet of paper that you were handed, there's a list of resources. That video is there, as well as a 2-page on how we ended up with this 5 decades of growing homelessness that we are in right now, the longest period of growing homelessness in our history. So I'm going to ask Barry if he'll show the video.
On October 7th, 1989, tens of thousands of people marched on the U.S. Capitol building in Washington, D.C. They gathered to hear Tracy Chapman talking about a revolution and Stevie Wonder call out for love and kindness. They gathered to be inspired by the words of Jesse Jackson, Susan Sarandon, Martin Sheen, Coretta Scott King, and the event's organizers from the National Coalition for the Homeless, the National Low-Income Housing Coalition, the Community for Creative Nonviolence, and the National Union of the Homeless. They gathered to stand in solidarity, those who were homeless themselves, along with their housed allies. They gathered to protest the severe lack of safe, decent, and affordable housing in the United States. October 7th was a sunny autumn day, and the flag surrounding the Washington Monument flapped in the breeze as marchers who had crossed the Potomac River from the Pentagon merged with the mass of people gathered at the monument. Others walked the nearly 4 miles from RFK Stadium, where they had been sheltered in the days leading up to the march. As they converged, the marchers made their way past the AIDS quilt laid out in rows on the National Mall, down Connecticut Avenue toward the Capitol. Some estimates put the number of protesters at 150,000. They came from the streets and the shelters, from churches, union halls, and school playgrounds. They came from kitchen tables and park benches where local organizing efforts were born. They came from Miami and Portland, Denver and Los Angeles. They came by the busload from Boston and Atlanta. More than 500 people came by bus from Chicago alone, and a group of 250 people walked to Washington from New York City, a trek of 16 days. Children from Dayton, Ohio pulled red wagons full of letters to Congress pleading for action. And people came from the streets of the nation's capital itself, where they would sleep again that night, and the next, and the next. Together they had one simple demand: housing now for all Americans. Specifically, they wanted restoration of $24 billion in federal funding for affordable housing that had been slashed from the nation's budget under the Reagan administration. These cuts, along with the growing income and wealth gap, were widely understood to be a major driver of the dramatic rise in homelessness in the early 1980s. Many local marches prior to October 7th built momentum that culminated in the Housing Now March, which was and remains the largest collective outcry for housing as a basic human right in the nation's history. Building on previous advocacy victories, such as passage of the Stuart B. McKinney Homeless Assistance Act in 1987, the momentum galvanized by the Housing Now March led to additional victories, such as creation of the Cranston-Gonzalez National Affordable Housing Act in 1990. The march also coincided with the groundswell of activism. Local grassroots organizing flourished, and acts of civil disobedience occurred across the United States, including occupation of empty buildings, a coordinated multi-city Take Off the Boards campaign during the months leading up to the Housing Now March. Many of these efforts were led by people who were themselves homeless, and by the faith community, which has played a central role in responding to the homelessness crisis. While Housing Now was organized in response to the epidemic of contemporary homelessness in the United States, it is important to recognize that homelessness did not begin in the 1980s. In fact, historians such as Roberta Ann Johnson, Kenneth Kuzmer, Todd DiPastino, and others have documented waves of homelessness that go back to the earliest days of colonization. Over the centuries since it first appeared in the cities of the Eastern Seaboard, homelessness has impacted some more than others. Native Americans and African Americans, immigrants, veterans, people with disabilities, children and youth, and the elderly. Homelessness has spiked with each major economic recession and has receded as more humane policies have gone into effect, including veterans benefits after the Civil War, Social Security for all Americans, Medicare and Medicaid, and a massive infusion of federal funding for affordable housing in the years following World War II. This combination of housing, healthcare access, and guaranteed income caused homelessness to recede, so that when the homelessness epidemic exploded in American cities in the 1980s, it felt new. Since then, millions of Americans have experienced firsthand the horrors of living without a home. Men, women, children, youth and young adults, veterans who fought for this country only to be failed by it when they returned from war, people suffering from mental illness and addiction, people fleeing domestic violence. In cities across the U.S., people of color, particularly Native Americans and African Americans, remain disproportionately overrepresented among the ranks of those experiencing homelessness. Homelessness is not new, it is not colorblind, and it is not inevitable. Homelessness can be shaped by changes in public policy and funding priorities, which can in turn be shaped by grassroots organizing and civil disobedience. As the United States continues to face homelessness on a massive scale well into the 21st century, it is important to ask what we can learn from the past, from our successes and our failures. First, community-based grassroots organizing is an essential catalyst for social change. Those in power never cede that power without well-organized, focused outside pressure. Political will is absolutely essential to create social change and to drive resources to solve homelessness, but it will never occur without strong, unified organizing. Second, those most affected by homelessness must be in decision-making roles around funding, policy, programming, and advocacy. Finally, We need a dramatic recommitment of resources at the national level to restore affordable housing to a level that allows every American to have a roof over their head. Such a commitment requires political will and a collective commitment to move beyond our society's complacency and acceptance of homelessness as inevitable. As we seek to learn from the past and chart a better course for the days ahead, we must rethink our current approach, recommit to grassroots organizing, and elevate the voices of people experiencing homelessness.
Thank you so much. I encourage you to take a look at the 2-pager that you have as a handout. That'll give you a lot more details on how we got into this mess and the ways that we do. I think the real key for us all to remember is that as people of faith, that we believe that we all have the divine spark of God within us, and that we, as people of faith in all of our different world religions, as we also have as a link to on that sheet of paper, is that we are called in our sacred writings to love others as ourselves. Thank you.
Thank you. Maybe we could just take about 3 to 5 minutes to have people write down any questions that they may have, and then we'll collect them. And don't be shy about asking questions, because we've got an hour to fill yet.
As people write their questions, Doug and Hal and Jean will collect cards and bring them up, and we'll do our best to answer your questions. In the meantime, just a little tidbit about grassroots efforts. I serve on the State Board of Directors for the Minnesota Social Service Association, MSSA for short, and we just had our Capitol Day on the Hill yesterday. Monday. Today's Wednesday. It was on Monday. And I met with my local representative and senator to where I live, but I encourage everyone to write their representative. If you don't know who represents you, you can find out fairly easily. If you go to Google and you search who represents me, the first link that pops up is a government website. You put in your address and it will tell you. And then there's links right there that you can email your representatives, bring up any topic you want, although tonight would be great to do homelessness. So anyway, Monday I met with my representatives and I told them about homelessness in Health and Human Services and what's that mean for us and our funding, and how do we help people currently and what's needed to do more. As you know, this year is a bonding year. However, I did get some good intel that there's a projected surplus yet, and they have ways to move money around yet this year in order to pass some of our bills. And one of our bills is to increase our housing stabilization cost so that they have more to work with when they try to transition people. Anybody who's moved once in their life knows $3,000 is not hardly enough to rent a truck and haul all of your belongings and get new belongings if you haven't had any already.
And if I can just echo that, is that it's folks are working for you. These are our tax dollars that they're using. As was mentioned, we have an additional 1.3 billion above what the forecast was in November that we're going to have available for resources at the state level. Last year, we passed $2.6 billion for housing and homeless services, from outreach to prevention to shelter to transitional housing, mediation services, rental housing, both subsidized and not subsidized, as well as home ownership opportunities for folks. And then today at the federal level, and it's part of the reason I'm not there is because I have been very busy working on federal legislation. We passed $460 billion out of the House of Representatives. I know that sounds amazing for some people that have been seeing us kind of delay on a lot of those types of things. But we had an increase in our homeless assistance grants to $4.05 billion, a $418 million increase over last year. Plus, we were able to subsidize all of the existing Section 8 housing choice vouchers. That's a way that we help pay rent for folks, as well as the project-based units. So we are extremely excited about the resources that we are using, our resources, to really help folks. It's not enough. We spend 2 to 3 times as much money on those of us that are Caucasian homeowners in our tax subsidies to be homeowners than we do actually for people with very limited income in their rental housing. Thank you.
All right, I am glad of heart that I have some of these to deal with. But I have a personal question too, or at least a question that comes from a person, me. And it's gonna, I think, well, there's something to be said for being the moderator. Sergeant Yakovlev, you seem to be like one of the people that are the initial contacts for people. And you said you run into them camping in the woods or something, and specifically with respect to like the first time a homeless person or an unhoused person has a contact with an official, it seems like it's you or someone like you most of the time. What do you do if it's like 10 degrees out and there's a guy sleeping in a sleeping bag or a woman, and I don't want it, and you say, you know, do you want to be here? Can I help you? And they say, no, I don't want to be here. What can you do to help them, like in the initial basis, and what can you do to, not you, but like what can we do to, like an intermediate problem solving?
Yeah, I think if I understand you correctly, like what would be a response if we come across somebody like that, right? So the answer to that would be is that we call either Dakota County Crisis, which is 24-hour, 7 days a week. You know, they're open holidays and weekends and whatnot, or we call the LI services right from the scene. And typically those folks, one of these entities would help us. They will come out to the scene and we'll try to find them housing. So I think we're talking about hotels, and hotels vouchers will be able to find a placement for them right away. And if not right away, somebody the next day will come out there and help them out with that as well. Okay. Thank you. The first question on the list, and I'm not sure who is the most, who would really want to, who's most qualified, I guess, to answer this. But the question is, how would universal rental assistance transform homelessness? That's about it. So anybody have any ideas on, like, how would universal rental assistance transform homelessness? Would it work? Because I know that there is a certain amount of, like, there's different reasons you might have a job loss, and that would maybe lead to different long-term course than some type of mental illness or a myriad of other issues. But tell me, how would the universal rental assistance transfer work? Who knows that?
I can talk just real briefly too about that if you'd like.
Go ahead, Sue.
Okay, so the main thing is that having universal rental assistance would provide that income support for folks that are working maybe at your grocery store or that are at your coffee shop or serving you meals in restaurants to have enough money to be able to afford housing. The real issue is that we have landlords that discriminate against source of income, which means they won't take a rental assistance. So we're trying to amend the Human Rights Act right now, which does protect public assistance to include rental assistance, but it would basically end homelessness for the vast majority of people.
And I can just add to that, oftentimes in our shelter system, we are spending a lot of time waiting for a rental assistance resource to become available. So we've got the social worker, we've got the person in need of housing, and everybody is, you know, holding pattern until rental assistance becomes available. If we had readily available rental assistance, we could clear our shelters much faster and make better use of those spaces for more people if they were to enter into homelessness. So from a prevention standpoint, like Sue said, it would help people from becoming homeless and from resolving that episode of homelessness. When somebody lands in shelter, it would be extraordinarily helpful to have quick, easy access to rental assistance.
So only 1 out of 4 households that are eligible for rental assistance actually get it, as far as the subsidies that we have available on the federal level and on the state level. Whereas those of us that are homeowners, if we are at a certain income, we do get that subsidy for our housing and how we write off the different things on our taxes.
All right. One of the next questions is, in what way could a person volunteer their space for emergency shelter, lodging for people within their home, and where can you volunteer to help build, paint, make food, except for the unhoused or potentially unhoused? And I'm going to get in just a little bit of a plug here for a program that we just instituted here maybe a month or so ago. From time to time, we could go out and get quart bags, Ziploc bags and that type of thing, and fill them with everything from energy bars to toothpaste to cookies, to other like non-perishable things, and then have them in our car. And when someone comes to you, or you see a sign of someone saying, I'm homeless or I need something to eat, if you give them that bag, you can at least solve the problem for a few hours or for a day in terms of getting them some nourishment. Or socks are important. Homeless people tend to not have the best wardrobes in town. And I know that it does get really, really cold. So that's one thing. So does anybody know on the panel, is there a registry or a charity or some type of social service agency where you could say, listen, I got, my kids are gone and we have a 3 or 4 bedroom house, and certainly for a week or so or 2 weeks or whatever it is, whatever amount of time you can do it, especially during the cold weather, we would welcome someone into our home. Is there a way to make that work?
Look, there we go. You know, there are organizations that have done those kinds of things. I think Avenues for Youth is one that comes to mind that really spearheaded a host home program. They're kind of nationally recognized for, they have a suburban, and some of this was pre-COVID, so I don't know what's all still happening after COVID, but pre-COVID at least, you know, they had a suburban host home program where a family could go through a pretty extensive training process and then bring a young person to live with them within their own home. They also had an LGBTQ specific one, as well as a kind of in the city one. So that's one that comes to mind. Certainly Beacon had done the Families Moving Forward networks, where it wasn't homes, but it was churches that were kind of the rotating model. And again, that all kind of got weirded out during COVID as well. So some of those things have changed, but those kinds of things certainly have existed. Part of the challenge is some of those system things, right? When you get into issues of potential safety, issues of screening both of the families as well as the individuals, and those are very difficult programs to run. But I do think that there's something really powerful about saying, you know, we have these communities and we have all these empty bedrooms and we have all of these people that need housing, and certainly there's a disconnect between why do we have empty rooms and people sleeping outside, and so whether or not there's ways of organizationally connecting those dots, I think it's really well stated to highlight the fact that is the state of reality for much of the suburbs, at least for sure. I don't know if anybody else has other thoughts on that.
We did have the Share a Home program for a long period of time, up until about 2005, when it was defunded by the state government. That was run by Lutheran Social Services, doing exactly that, matching up families that had, or elderly people that had vacant bedrooms that they wanted to share with a family or with an individual. It's something that we're working on right now in state legislation with both close-knit and other groups. Sharing homes are a wonderful way. Intergenerational housing is a wonderful way of providing housing options. And as has been mentioned, many of us are living in single-family homes with vacant bedrooms. We also have the accessory dwelling units, or the old mother-in-law apartment option that's available, that you can build an accessory dwelling unit on your property too, to provide that type of housing.
Okay. I think, Madeline, this one might be for you. One of the attendees asks, you shared how many people the county serves, Dakota County serves during a year, and you kind of described a little bit that there are more that are not served that could be or should be. Can you share some number or some description of how many people are turned away, say in a year or a month, and what is the solution to that?
So in our shelter we have a decent idea of how many people are experiencing actual homelessness at any given time through our school systems, through our annual point in time count that I shared earlier. So at the end of January this year, a team of people led by Ally Street Outreach went out into the woods, into parking lots, 24/7 gas stations, and tried to find as many people experiencing homelessness that night to give us a sense of how many people are experiencing homelessness at any given time. The number we counted that night was 80. It is not likely, it is true that there are many, many more people who are experiencing homelessness on any given night in Dakota County than the number that we were able to count. So we know our shelters were full. Those folks who were experiencing homelessness, we know we were not serving them in the best way that we could that night. We also know that the folks that I shared some of our eviction numbers. We had 1,800 evictions in Dakota County filed. We served some of them, but we didn't serve everybody. In part, that's capacity. If we had more capacity, we could get to folks who are experiencing those housing crises. So it's frankly really hard to pinpoint an exact number of who is experiencing housing instability, but we have a sense. We have these numbers from the school district. They collect great numbers about a number of students who are experiencing housing instability. We have our point in time count. So until we go out on January, the fourth Thursday in January, and we don't find anybody, and until those school numbers report at 0, we know we're not serving everybody that we could.
What would it take to get to 0?
I think it would take a lot of different interventions. We're in the business, I think pretty much everybody here is in the business of responding to an existing crisis. I think we need to, as a community, as a society, start thinking much bigger picture. So why are so many people living in poverty? Why, when somebody has a medical crisis, do they end up in our homeless shelter or on the street? That doesn't make really any sense. So I don't think we're going to service our way out of this issue. We're here. We will continue to do our work. We'll continue to do better. But we have to think, what do people need to stop those crises from happening in the first place? It's not going to be more shelter beds. It's not going to be more eviction prevention services. It's going to be much bigger picture than that. So we got to think about healthcare. We've got to think about universal rental assistance. We got to think about all of those protective factors that we can build into our system to make sure that people can weather the storms when they arrive.
And I'd also just chime in that we also need more housing units. I mean, that's the like the easy solution to end homelessness is more housing. I mean, we very much believe in a housing first approach, which says that all of these other things are important, these other service pieces, but 70 to 80% of our youth, once they move into stable housing, all those other symptoms go away. They no longer have addiction challenges. Their mental health stabilizes. Like all of these other things that we see as causes of homelessness are often symptoms of the crisis of being in this traumatic space of not having stability. And so if we build more housing and put people in them, the problem goes away. And so it's a very simple solution. Not that we don't need these services. Those I think, because then there's a portion of those youth or participants that once they get into their housing, then you kind of a couple months later you sort of see what's left. Like after they've gotten stabilized. I'm still having mental health challenges. Okay, now we need some wraparound mental health services. Oh, I'm still having some addiction challenges. Okay, now we need some of those. But a lot of it just goes away once people are out of the situation, because homelessness is not an identity, it's a state it's a circumstance. And once the circumstance changes, all of those other things often just go away.
And can I just add, so in Dakota County, what that means is that we need to build 6,875 more units just to help the folks that are extremely low income that cannot find housing. You need to make $53,160 a year to be able to afford a 2-bedroom apartment in Dakota County. Most of the folks that you see at the grocery stores and gas stations and where you get your coffee and other places, your restaurants, are not making that. So we have to both build housing, plus we have to have rental assistance and livable incomes. Thanks.
What would be, and just to follow up on that, what would be the definition of affordable housing?
It's housing that people can afford at 30% of their income or less. And so if you're making $30,000 a year, you shouldn't be paying more than $10,000 total in your rent. So, if you're making $10,000, you shouldn't be paying more than $3,000 or so a year for your rent. So it's really a combination of both creating the affordable housing and then also providing those subsidies so people can afford that housing. And so our developers can actually develop the housing, both for profits and nonprofits, to do that. But really the standard is 30% or less of your income should go towards your housing so that you can meet your other needs in your family.
Okay. Oh, absolutely.
Hi, Sue. This is Teresa Battle. Can you follow up with the part of affordability that's dependent on your city's medium income?
Sure. Yep.
So Burnsville is different from Egan.
Right. Yep. Each city is different as far as what the median income, and again, the median income is kind of that middle point. It's not a mean, which you're averaging all the incomes with, where half the folks are making a lot more than that money and the other half is making less than that money. And each of the cities in Dakota County has a different median income. How typically we look at median income is in the whole metro area. It really does not account for really the types of jobs that we are creating in all of our different communities. And so in Burnsville, the median income is much lower. We have a lot of apartments in Burnsville. We have a lot of service and entry-level jobs that are paying anywhere from $7, $8, $10 an hour to $20 an hour. That is not enough money at $20 an hour to afford housing in Burnsville.
Just to finish my public service announcement that I left half of it off. We have some of those bags that we packed available out in the foyer. So if anybody would like to grab one or two and hand them out to someone who might put them to good use, they're free. So this is a personal question, but is it cheaper or less expensive to provide housing assistance, or is it less expensive or maybe a better policy to fix what got the unhoused in that situation. Everything from mental illness to, huge unexpected bills to your spouse left you and took all the money or whatever. Is that, and I know that's a broad question, but anybody want to jump in?
So it costs about, it's 10% in regards to, if we prevent people from becoming homeless, it costs us like $1 compared to $10 if people actually experience homelessness. We are all broken people. We all have problems in our lives. We all use services. And so to understand that we are going to be utilizing services, but we all need housing. And so we do better, as been mentioned before. Once we get into housing, we are more stable. We've moved off of that survival level of living, and then we can access and start growing. Maslow's hierarchy of needs. I'm a retired psychologist, so I talk from that level of recognizing that, you take care of people's basic needs and people have the opportunity to thrive. And of course, we're going to each have our problems that we're going to go through in life, and that we need to be there for each other, to be loving, caring community members and family members, and to encourage people to do the best that they can.
The card reads, can you explain the different definitions of homelessness both organizations use, schools versus county? So are there subdivisions of homelessness other than just you don't have a home tonight or a place to go tonight?
So there's a federal answer, and there's a school answer, and there's a whole bunch of answers. Okay. The federal definition of homelessness is sleeping outside, in your car, or in a place not meant for human habitation.
Or fleeing domestic violence.
Or fleeing domestic violence, thank you. And in order to, if we have any amount of federal money going into our programs, we have to prove that out. So we have to prove that that's the case. We rely on our partners, police department. They might give us a statement saying, yes, I saw this person living outside. And then that gives us the okay to use our federal dollars for that purpose.
So what you take those federal dollars and what do you do with them?
For example, we have federal dollars that pay for part of our sheltering activity. And so in order to have somebody come into the shelter, if they're sleeping, if they're doubled up with friends and family, then that doesn't count for accessing shelter, which is super frustrating for people who need to get out of a situation, or don't want to stay in that doubled up situation anymore. But we're really honing in, because of that federal money, we hone in on people who are tent camping or sleeping in their car. But I think the schools also have a different answer.
The criteria we use to identify.
Here.
All right, sounds good. All right, we do, so the criteria, we have our social workers that have the criteria, and so our criteria is just, we get the information from the families, and it is, they can be living in a home doubled up, but if their name isn't on the lease or the rental, then they're not part of the home. That means that they can be kicked out at any time. And so they don't have that contract that's in there. I think other than that, that would probably be one of the biggest differences that I think it was probably just that piece there would be those. But I mean, it can be loss of a home, it can be living in a shelter, it can be living in a car. We do have our high school students that might be going from home to home and staying on somebody's couch and getting their food that evening. And then a couple days later, they find somebody else to go with. So that is another thing, is that it's that piece as well. So it's our older youth that are also reporting homelessness.
Yeah, the state of Minnesota has a separate definition of homelessness that is essentially the same as the federal one, but then also does allow that couch hopping kind of doubled up. And so depending on the funding stream, and that's where like nonprofits and government agencies like just have to be really clever and smart about, oh, this person fits this funding stream, and so we can get this, like, and it's just a whole like puzzle that you have to do to figure out, okay, what funding stream can support this person in their situation.
And so we have about 10 different definitions of homelessness on the state and federal level in different federal agencies. And so the definition that we like the most is the Department of Education, which is the way that the vast majority of people actually experience homelessness is being doubled up. And so it's really critical that we have one definition. If you're homeless, you know that you're homeless. We haven't quite helped our federal government and state government understand that, and that we just need to make sure our resources are flexible enough, because we spend an incredible amount of administrative dollars and time trying to document and prove that somebody has experienced homelessness.
Superintendent Battle, I guess I always kind of figured that everybody going to school had at least one parent and maybe a sibling or two and a place to go back to. But it sounds to me like some of the things that you experience in the Burnsville School District is that there are just kids that don't have a mom or a dad or a guardian or a place to go. And how do they get in that situation? What causes that estrangement, apparently?
Well, I think when you look at teenagers, that growing independence, families are different and there's conflict, and so there can be many reasons. You mentioned LGBTQ. That's a big reason. They're not accepted in their home. So it varies for our teenagers. It could be a result of sexual abuse, as you told the story, so there are varied reasons. Sometimes it's simply overwhelming for their parents, and so the teenager will say, take care of the younger siblings, I'll leave. Amy, can you think of some other stories? So it's varied.
I think you kind of hit a lot on pretty much right there. With our older youth in high school, it usually is a family situation where they're not getting along, and then the youth leaves and goes and stays on a couch, and then a lot of times that youth is not welcome back in the home again for whatever reason, as mentioned around. So
This is one specifically directed to you, Madeline. That you spoke, I know, about like a survey on one day, and you went looking every place that it's likely to look for a person in need of assistance, or is actually homeless for that night at least. Do you do that like January 20th of every year, or do you some like in May and some in August and some in October?
Mm-hmm. So our street outreach team does this every day. They are looking every day and working every day with our communities, police officers, libraries, community members who see somebody experiencing homelessness. So they do that every day and make those connections. We're required, the entire country is required on the fourth Thursday in January every year to do this annual point in time count. So the entire country does it at the same time. We don't love the fourth Thursday in January, frankly, but the federal government has told us to do it then, so that's when we do it. The state also does, every 3 years, does a survey of people experiencing homelessness, so we can kind of combine some of these data points that are happening on a regular basis to give us our understanding of the big picture and how it's changing over time.
Is it, from your experience, is there more homelessness one part of the year, like one season of the year, or one holiday of the year, or something of that nature, or is it random and it could be a really bad summer this year, but it'd be a terrible winter next year instead?
I think the biggest consistency we see is an increase in homelessness over time, kind of no matter the season. If it's really terrible weather, we might see people call in that favor. So we might see some distinctions because of weather. We might see some distinctions because of the school year and mobility, but really the consistent thing that we see is this increase year after year in all of these counts, no matter when they are taking place.
I would say for us, just organizationally, and this is all anecdotal, right? But it's we see an increase in new intakes right as the weather starts to get warm, and then right as the weather starts to get cold. And so right as the weather starts to get warm, because the nice people that you found to stay with are now tired of you being there, and so it's time to move on. And they feel less guilty because it's warm outside now. And then right when it starts to get cold, because youth that have been maybe okay with staying in their car are now suddenly getting nervous about what winter is going to look like, and so we see this kind of uptick then. But that's just kind of anecdotal. It doesn't mean that they weren't homeless the rest of the times. That's just when we hear from them.
I would say as a school district, we see an uptick usually around that April time because, that is about the time when if you haven't been paying your rent or you haven't been paying your electricity, that is about the time where they can be excused. And so we usually hold on for April and May is our big time.
Okay. One of the inquirers wants to know what like an individual could do and who should they go see to get some input into solving this, either on what can one individual do or two individuals do, but also what government agencies can you go to and encourage them to increase budgets and increase their attention to this need. Those of you who have these green programs, we had a representative from the state of Minnesota that had to cancel, unfortunately. And I see that there's a website for the Minnesota legislature, Minnesota Senate Housing and Homeless Prevention Committee, and for the Minnesota House Housing Finance and Policy Committee. And I suspect you could go there. They probably have a website, but that might. Okay. That would be wonderful.
I think I only need one mic. Thank you. And I'm going to sit down like everybody else. Join the party here. Yeah, there are things. You can get a lot of information. You mentioned the website already. Going to find your representative. But to me, the most important thing is to be getting your voice out in events like this. What I love is for people to come and show up at my office. It's been day on the Hill day for so many things this week and last week. And it's so important because we hear the stories, we see the people, we see testimony, and it makes it real for representatives. It's very easy for problems with statistics to become abstract. And when the heart comes out of it, then we don't make our best decisions. And so bring the heart, help us see the heart of the stories. The video was good for that. The stories tonight were great for that. I will go back and I will use those stories and I will remember and I'll see the faces. So I think those things are really powerful. Another thing that is the easiest thing in the world is to send emails to your legislators. We read them. Even if you don't get a reply right away, we read your email. We put your email, I care about homelessness, I want more investment in housing, please support bill whatever, and that goes into a database. And our House leadership looks at that and says, oh, there's a lot of people who want this. Or you see a bill that you think is just terrible, they're going to slash housing budgets. Do the same thing. I'm opposed to this bill because we do pay attention to them. Super quick and easy. You know, my name is so-and-so, I live at such and such an address, and I'm your constituent. I care about this because support this or don't support this, thank you. So easy, you don't have to be a writer, and we pay attention. And so every time I go to an event, I tell people that, and I ask them to tell all their friends, because even the people, you know, the people who think they can't imagine why I'm standing up for the things I'm standing up for, I'm glad I'm hearing from them. And I write them back too, because, you know, that's what it is to be in a representative form of government. And so I think I can speak for my colleagues that we take that seriously as a responsibility. The other thing I'd say is that someone asked about what do we do to end homelessness, and I don't remember who made the point that it's the root causes, or maybe everyone made the point that it was the root causes. But like for today, for example, today I was in the Economic Development Committee that I sit on, and there was a program that does youth mentoring, especially for Black kids happen to be in Minneapolis. And they were talking about that and talking about helping build the children's emotional intelligence as well as their jobs and professional skills. And it's talk about root causes, helping kids learn how to feel good about themselves, to accept who they are, to know that they can grow and thrive and not just be a doer, but the full human. If I had one wish for the next session, it would be to fund mental health services. I mean, we are so far behind on what we need to spend on mental health. We need to fund housing, we need to build, but we also need to be taking care of the problems that people are facing and invest in the people. I mean, invest in people and what they need to thrive. And, you know, I think we did a really good step toward that last year in the many ways that we invested. But we knew that we were making up for decades, you know, going back to Reagan, going back to Pawlenty, going back to many of the budget decisions that have been made. And I'm speaking factually here. I am not speaking in a partisan way. It's the policies that were put into place that led to underinvestment in our schools, in our healthcare, and our housing.
Thank you.
I think if I could just add real quickly, and you have some of the greatest representatives and senators in Dakota County that are key leaders in the Senate and the House, as representatives spoke, and Senator Port, who could not be with us today, is the chair of the Housing and Homelessness Prevention Committee in the Senate, as well as many other folks. I won't be able to name them all, so I'm not going to try to. So it's important that you use your God-given voice and power and say what needs to be done, because these are our resources. And if you want to get weekly updates of what's happening at the state capitol and what's happening on the federal level as far as action alerts, please sign up for our Constant Contact newsletter and email at MICAH.org, and you'll get that information. And that's a very quick way that you could just send off a letter, make a quick phone call. If you're afraid to make phone calls, which I always talk about resisting that fear that we all have about making calls or saying I'm not smart enough or I don't know this well enough to do, is that you can call after 5 or 6 o'clock at night and just leave a message, and you won't have to actually talk to somebody.
In those, just a note, MICAH is spelled MICAH. .org.
Yep, yes, correct. It's MICAH.org. And you just go to the bottom of our front page and it'll have a piece that you can sign up for our newsletter and website. I will put that also in the chat for folks that are joining us by video, and encourage you to go there and just sign up. We have about 1,630 folks that are on that Constant Contact. We have an incredible open rate and response rate of at least 50% oftentimes on our action alerts. And we think that we are having a major influence both at the state as well as at the federal level.
One of the questioners would like to know, we discussed the statistics and the numbers of unhoused or homeless people in Burnsville. Are those similar in the other cities like Apple Valley, Eagan, Hastings, Lakeville, or I'm sure there would be some differences, but are they generally in the same neighborhood, or is there one place in the county that's more of a hotbed of homelessness than another?
The numbers that I shared are Dakota County wide. And I think that map that I showed earlier, which I don't expect anybody to have memorized, generally represents where we see the greatest need. So Burnsville, West St. Paul, South St. Paul, Apple Valley, Eagan, and then we have pockets in Hastings. So certainly in terms of where we need services, it is all over Dakota County. There's not one place that, while we might have more numbers in one place or another, homelessness is not centralized in any one place in Dakota County.
What is the amount of money about attributable to homeless spending, say at the county level, Dakota County, on an annual basis? Just about. I know that you can't give me a right down to the penny.
Phone a friend. 12 million, says one of my bosses sitting right in front of me.
But I mean, that's just direct service. I mean, the cost. So I mean, we're deploying federal resources, rental vouchers.
Sure.
Yeah, it's in the tens of millions, if not more. If you look at the investments that Dakota County has made into workforce housing, senior housing, we built affordable housing in West St. Paul for singles. We're in the ground now with another housing unit with a bedroom preference. I mean, it's not just one round. We are across the board investing in all different ways and also deploying both state and federal.
Okay. As an interim, I'm sorry.
$600,000 a year subsidizing services for 41 families at Cahill Place in Invergrove Heights, in a facility that was built with help of state dollars. But that, I mean, that's just that one facility that over $500,000 a year is going in to support 41 or 42 families. So, I'm done. Thank you.
This is probably another good one for the Dakota County types. Of all of the potential remedies for homelessness, which one or two offers the fastest results and the most results? Like, which one can you do first to get really a good knockdown of the problem fast and albeit just a beginning?
Take a stab at it, but please chime in. I am a huge fan of our prevention services, and I would love to see us be able to do more in that space. Like Sue said, it's cheaper, so if that's the only motivating factor, but also solving a problem while somebody's in their home versus creating that trauma of homelessness for the whole family, and the whole response system needing to rally around that person to rehouse somebody. That's trauma that family doesn't need to go through. And oftentimes we don't have space in our system to be able to respond right away. So it creates a really terrible situation for that person. So in addition to the eviction court work that I highlighted earlier, we have services that we've started deploying in just general apartment buildings throughout Dakota County. They're flexible. They don't require, all of us took turns explaining super complicated definitions of homelessness. That doesn't matter. If somebody needs help navigating a neighbor conflict or figuring out how to get their rent paid or accessing services, that service in those apartment buildings can help with that. And it's been a really effective service. So if we have to do a little bit everywhere, we can't just solely focus in one place, but prevention services are a big bang for their buck. Anybody want to add anything?
If I can put a plug in for Dakota County, you have probably the best website in regards to that one-stop shopping for folks to just be able to access those resources very rapidly also. So people can get information very quickly about what resources are available. They don't have to necessarily fill out a bunch of different applications. It's one time put information in, and the county can find out what resources that you're eligible for. So encourage you to go to the Dakota County website and look up homeless services or different types of public assistance, and you'll see it very easy way to access, as well as a phone number if you have any technology issues or difficulty in filling out applications too.
I would just say from a case management standpoint, we're not crisis workers, although many people think we may be. So when clients call us and they're in crisis mode, we often go to our counties, Dakota, Scott, any county we're with, and ask them for their crisis team to respond. And oftentimes, at least in most of our cases, it's a mental health crisis, but it also means that they're at risk of losing housing that night. So it might be a quick trip to the ER and a 72-hour hold if that's what they need, but it can be they'll find a hotel room, they'll help them apply for emergency assistance, which is just emergency financial assistance as quick as you can get it. So that's what we do primarily to address any emergent situations. And so we really rely on crisis response. Horizon Homes down in Blue Earth County does a lot with that as well.
Other than the interventional type things from the police and from social workers and things, is someone who is interested in addressing homelessness with government, do cities have it seems like counties have a big role to play, and certainly the state has a big role to play, but is there anything that cities are in charge of that could be lobbied or increased or changed?
Thank you. Because I just leaned over to Marty and said, there's two things that we're not discussing here. Cities, they have control of the land use. So we don't, the counties don't, the state don't. So when you talk about contacting people, you want to contact your city councils if there is an application coming in for affordable housing. That slide that Madeline showed you with the room all crowded, that was one room. There was actually two rooms that looked like that. Because the second thing I want to address is perception. When we were going through that process of talking about a shelter at the Norwood, most of the people thought it would be, you'd have homeless people lined up outside, getting into the neighborhoods, and that's not what it was. I mean, kudos to our staff, because we were under the gun, under someone else's guidelines to have that discussion. And we deviated from what Dakota County does, and we do a really good job at that stuff. But we weren't able to do our process. So the perception was that people were going to be coming and going as they pleased. And that wasn't it at all. You had to get appointments, you had to be vetted, you had to, all these things were in place as far as a process to be able to get into that facility to have a roof over your head for the night. So it's perception and it's city councils.
To encourage you to run for city council, also for your housing planning committees and be on those because they do set the zoning as was talked about in the comprehensive plans, that each city has to do every 10 years for the Met Council. So this is a wonderful opportunity, is show up at your city council and talk with your city council members, run for city council, be on the planning commission, because you can help make sure that there is affordable housing. Most of us in the room right now, we're renters at some point. 97% of Americans rent at some point in their lifetime. And many of us, I'm in my 70s, so there is a good chance that I will rent again too. So we need to make sure that we are having housing that will meet the needs of all of us throughout our entire lifetime. And that means that we have to show up and use our voice and use our power and really want to be a welcoming community for all people and the diversity of housing that we need in our community.
I understand that there are some people that are attending via Zoom that have some questions, and I'm not sure how we get them. Oh.
Can you read it? Dave, can you see it? Okay, it says, okay, I gotta get closer to. Has Dakota County been able to tap into the $2.1 billion from the 2023 state legislature's bill specifically to be used to address homelessness? Could this build a shelter in Dakota County?
So some of that money comes directly to Dakota County. So we have received some of that money already. Some of it was in the form of grants that we need to apply for. And so including the shelter capital dollars. So that is what Commissioner Workman was referring to. There was this opportunity to apply for capital dollars to build shelter. And we scrambled to try and make that application, did not make that application. And a lot of different agencies across the state applied for that money, and some people got it, and a lot of places didn't. So we know that the amount of shelter capital dollars that was allocated in the last session, there was a huge demand for it. And we could definitely use more of it. In addition, shelter operations dollars, we are really in need of shelter operations dollars to take the good work that we started over the years, that we ramped up during COVID, and to keep that going. So.
Again, I can just speak anecdotally for our organization that because we certainly applied for some of those funds as well, and I think our total ask was for the biennium was just under or just over $2 million, and we were funded for just over $1 million, which is awesome that we got $1 million for 2 years, over the 2 years. But that gap of the $1 million that we didn't get is, I think, what we're all like struggling with is like, so there's still this need that's there. We asked for enough funding for 12 shelter beds. We got enough for 5 shelter beds, and so like. And 12 wouldn't really be enough, but that's kind of the challenge, right? Is that there's this big amount of money, lots of organizations, lots of entities applying for it, and Sue probably has the exact numbers, but I think it was roughly half of what was asked for was funded.
I have a bill out for 360 communities to build a new Lewis house for sexual and domestic violence. It would replace the capacity from the Hastings closed shelter and it's a beautiful project and trauma-informed design. It would just be a wonderful thing, and I'm hopeful that assuming that we have a bonding bill, I'm hopeful to see that go through.
A couple of these are more announcements. One from Emily Solder. For your information, March 20th, 2024 from 9 a.m. to 3 p.m. is the Homeless Day on the Hill, where you can talk to your representative person, which I would think would be at the Capitol. Okay. And we also have a resource page at our church at pcota.org/, which in PCOTA stands for Presbyterian Church of the Apostles. So pcota.org/. And what else have we got? I think that's about it. I do have one question that we might be enlightened on.
You also are invited to join us at the MICAH South chapter, the Dakota County chapter. We meet the second Tuesday of each month at 5 o'clock by Zoom. And again, you can just email me and we'd be happy to get you the Zoom link. Jerry, who is our board member in Dakota County, Jerry Daly is on the Zoom right now. If you are in the Zoom and you want to put your name in the chat, he'll capture that and we'll send that to you, or you can just send us your email and we'd be happy to have you join us.
All right. I know that one representative, I believe from the State Department of Human Services, was going to be here, and I think there was an illness. But I recall, I think it was just became effective in like July or August, kind of a reduced criteria for running shelters and things like that, or like lessening the
there was a change.
burden.
There was a change in the housing support program.
Okay.
So this is a program that's designed to assist people that are experiencing homeless, the housing support program, which is designed to assist people to get out of unsheltered situations right into housing. So we have, what will go into effect in October, is that now people on a number of different types of public assistance, including Social Security, disability, veterans assistance, and tribal incomes will only pay 30% of their income for housing. Before they were paying about 90%. We have legislation that's moving forward to include general assistance that was increased from $203 a month. That's what we were expecting people to live on, to $350 a month. Still not enough for people to live on. But that's where they would only be paying 30% of their income. So we're continuing to change our structure and our system so that really meets the needs of folks, so that people that have other costs that they're trying to take care of, like storage or cell phones or other types of things that they have, and they can't give up all their money because they'll lose everything else. And so some people do not go into those housing options that we do have available at the state level because of how much we're charging them. So by just charging them 30% of the income that they actually do have, we will have a much larger number of people that will be utilizing that program and moving out of unsheltered situations.
Those are all the questions I have. Are there any oral questions that can be made from the floor?
Max, this is addressed to you. Earlier, before the forum really started, we were talking a little bit in the narthex about how many calls you get a month. Can you share that, some of that information with us?
Yeah, I can. Like I said earlier, my partner and I and our social workers will respond strictly to mental health or people in crisis type calls. If I correctly remember, last year we logged over 800 of different calls. What's important to know, it's different people, so it's not the same person every time. So on average, I would say probably 2 to 3 a day of different types, and it can vary from somebody who is, as you know, an episode, first timer, or this is a persistent mental illness where we have to take action and make sure that they're safe and the community is safe, and whether taking them to the hospital or actually stabilizing them in the community as well.
Thank you.
One of the things I do at our church here is to bring food from our that people bring into the food shelf at 360. Now you'd say, what's that to do with homelessness? but they tell us that every dollar a person doesn't have to spend in the grocery store is a dollar they can put toward rent, and you can reduce evictions when you can pay rent. So, you know, you feel somehow frustrated when we seem to be admiring the problem, but there's just very simple, basic things all of us can do that can help.
Any other takers? No one wants to talk into a mic.
Well, then as Mother Teresa also said, is that we can always smile at folks. We can always say hi. And we probably all know we can always smile at people and we can always say hi to folks, as Mother Teresa would say. And that we can always help our family and friends that are struggling with their housing dollars. If you have resources that may be invested in the stock market or other places, invest in people too and help them stay stabilized. If we each helped 3 or 4 people, those of us that do have some resources, we would really decrease the number of people that are experiencing homelessness by just our own helping. In addition to utilizing our resources that we give our federal government and state government every year. And a lot of times we don't ask people what they're doing with it. And that's why you need to show up and say how you want our dollars used, is that, you know, we can use our own personal resources and use the resources that we're putting in to our government opportunities too. Thanks.
I think that's.
Thank you.
I want to personally thank the panelists for showing up tonight and sitting behind the green table. Thank you very much, and your presence was greatly appreciated. And we ended on time. Did you see that? It's 8:01.